Welcome to the Oriental Medical Digest. If you watch a newborn baby trying to focus, sometimes they appear cross-eyed. This condition is called strabismus, and while most of us outgrow this condition, some do not. Beside congenital factors, other neural, structural, and refractive damages can also trigger strabismus. If untreated, this condition can result in serious problems that will require surgery. Oriental medicine has a short and effective treatment that does not require intrusive operations.
Strabismus patients have been treated by a combination of surgery and long-term medications. In case of Korea, approximately 6% of the population suffers from strabismus, and 2 to 4% of Korean infants suffer from this condition. There are two kinds of strabismus. One is called paralytic strabismus, and the defining symptom is that both eyes have difficulty in moving freely. Usually, this is caused by an aftermath of an auto accident, stroke, or paralysis. Second, the symptom of non-paralytic strabismus is when one eye has normal movement while the other is fixed on one point regardless of the focal point. Non-paralytic strabismus is often hereditary. Strabismus is diagnosed when there is trouble with the nerves controlling the eyes. It is often caused by an accident or an inherited condition. Bifocal vision and uncontrollable movements of the eyelid are common symptoms of strabismus. A variety of tests are done to diagnose what kind of strabismus the patient is suffering from and what the apparent causes are. These tests include various vision tests which examine the differences in the eye's focusing and tracking abilities. One method of diagnosing the strabismus patient is by measuring the distance of the two pupils by a ruler to check the progress of the treatment. As the treatment progresses, the distance between the two pupils becomes closer than the distance measured initially. Through covering one eye, the progress of strabismus and the movement of the pupil can be confirmed. With these tests, the movement of the pupil can be checked. Strabismus can be classified into 4 categories. If one eye is fixed on an inner point, it is called esotropia. If the eye is fixed on an outer point, exotropia. And if one eye is fixed upward, hypertropia. Finally, if one eye is fixed downward, it is called hypotropia.
Oriental medicine prescribes acupuncture and herbal remedies for strabismus. Although these treatments address different aspects of strabismus and can be prescribed independently, most doctors agree that patients get better and quicker results when treated with both. Now, let's find out more about the principles and effects of these remedies.
What's the purpose of acupuncture therapy on strabismus? The purpose is to normalize the eye's focus by stimulating the 경혈 around the eyes, therefore stimulating the nerves that control the eyes and reinforce the muscles. Let's find out in detail about acupuncture therapy on strabismus.
주로 한방에서는 이 안과리 질환을
Oriental medicine uses 경혈 points around the eyes to apply acupuncture needles for ophthalmological diseases. We use the 찬죽, 양백, 사죽공, 태양, and 승읍혈 points around the eyes because these are related to certain points that will influence the 5 phases in our bodies. These 혈 points can work on the muscles around the eyes, so that numb muscles will relax in paralytic strabismus patients. In cases of child strabismus, this treatment increases the strength of the muscles which control the inner, outer, upper, and lower muscles for movement of the eyeball. It will contract the stretch muscles and extend the contracted ones. In particular, the treatment of paralytic strabismus involves relaxing the numbed muscles, and the treatment of child strabismus involves flexing and strengthening the inner, outer, upper, and lower muscles.
Oriental medicine believes that strabismus is caused by an invasion of bad energy into the liver. Thus, they use herbal remedies that can boost the function of the livers. Let's find out what herbs are used in this treatment.
There are quite a few herbs here. What are they used for?
The medical prescription used to alleviate strabismus is 보이는데, and it strengthens the spleen, stomach, and liver functions.
What are the main ingredients?
The main ingredients are 황기, 산약, and pectul, with 20 other herbal ingredients used in the prescription. 황기 helps the eyes and liver. It strengthens poor liver function caused by low energy and helps to increase metabolism. 산약 improves the functioning of the spleen and stomach muscles and also helps the movement of muscles around the eyes. Like 산약, pectul also improves the functioning of the spleen and stomach muscles, increases urination, and aids in preventing water retention. It also strengthens the muscles around the eyes. In addition to these 3 herbal ingredients, there are other ingredients that will also increase movement and strengthen the muscle around the eyes by improving liver and the digestive organs functioning.
If we look at the trial cases of patients who have been treated by acupuncture and medication, their vision improved by an average of 0.23 as a result of these treatments.
한방 치료를 하기 위해서 이제 병원을 다닌 지가 한 1년 반 정도 되는데요. 지금 그러니까 처음에는 굉장히 우려했던 부분인데 침하고 약물을 병행을 해서 치료를 하다 보니까 눈에 띄게 많이.
The most important purpose and result of strabismus treatment is to restore the focal point. Oriental medicine can successfully treat strabismus in 6 months in less severe cases and 2 to 3 years for more serious cases.
Strabismus should be treated as early as possible. Generally, it is believed that if the patient is not treated in its early stages, even surgery cannot cure this condition completely. However, strabismus patients should not give up, as Oriental medicine has a number of remedies that are highly effective and free of side effects. We hope you enjoyed the show today. Thank you for watching us, and see you next time.